Miss Jody here with another video for health, which usually meets 9:30 to 11, I think. Yes, 9:30 to 11. We're following with the class of the history of medicine following. So we're trying to finish up chapter 6 here while we're separated. Don't forget to be taking your notes on half sheets, and we'll glue them into the journal when I get back together with you. Hopefully very soon. I see we're having some progress in possibly opening back up our communities. And hopefully when we do that, we'll be able to meet together a few times to do some of our labs before we finish up for the year, hopefully. All right, so chapter 6, we were looking at chapter 6 for a long time, it seems like, and that's because chapter 6 had a lot of information in it. And basically, it was focusing on being able to maintain our health by preventing diseases. And so there's been so much information in this chapter that we've been stuck on it for a while. And it started out, if you remember, on immunology and understanding and reviewing the immunology world and how the system is created to function to keep those pathogenic invaders away from us and to fight off any of these problems that arise. And so we spent a lot of time on the lymphatic system and understanding antibodies and the infectious diseases, and then in like the categories of pathogens and viruses and protozoa and all that. And then we finally got on to the non-infectious diseases, and we've been stuck on this for a while because there's a lot of different non-infectious diseases in each one of the categories that they went over. So if you remember back, we talked about degenerative diseases, and we talked about the immunological diseases and the nutritional diseases and the psychosomatic diseases, and then even diseases caused by harmful substances. And we focused on cancer, understood how cancer worked, if you remember that. And then after that, and also other disabilities that arise from disorders and such. And then we went on the systemic diseases and disorders, and that's the one we've been on for a long time. So if we look back, you'll see all the way back to, I think the first one, yes, was cardiovascular diseases. So we started with cardiovascular diseases, and we had to focus on a lot because there was a whole bunch of cardiovascular disease, well, many pages of notes on that one. So diseases that affect the heart and the whole entire circulatory system, and the LVAD, if you remember that in the video that went along with that. And then we looked at a few of the categories of systemic diseases that are just smaller areas, like the skin, the diseases that affect the skin as a whole or system, and then the endocrinopathy, that was the ones that were affecting the endocrine system. So we looked at diabetes mellitus, remember that one? And I gave you this diagram to work through with the video, and then learn the difference between the type 1 and the type 2 diabetes. So hopefully you finished that. And then we went on to the gastrointestinal diseases and disorders, and those were kind of interesting, right? So especially starting with the dental caries, and then moving on to more complex things happening inside the system. Appendicitis, colorectal cancer, dysentery, all that good stuff. Foodborne illnesses. Then we looked at the ulcers and Helicobacter pylori. If you remember, I sent you a video on that to do that. So the particular bacterium that is problem at times in the stomach lining. And then we went on diseases of the liver and diseases of the immune deficiencies and lymphatic diseases. And it seemed like it went on forever, didn't it? Muscular skeletal diseases, so things with affecting the muscular and the skeletal systems. And then the blood, the diseases affecting the blood. And I saved some picture pages just in case we can do some labs for those when we get back. And then we finally get on to the last 3 to finish out this chapter. And so I've tried to just simplify them because we've been spending so much time on this, and I want to get through to move on to chapter 7. So we can finish up for the year. Okay, so the nervous system diseases and disorders. So to start as a definition, or words that would be in this category with the nervous system, neuropathy. And so neuropathy, probably better stated, is nerve damage. And so sometimes it causes severe pain, numbness, paralysis or paralyzation. I don't think I spelled that right there. It doesn't look right, but we could check that. And neuritis. See, I can't pronounce things today. Neuropathy and neuritis. Hopefully I said that right. This would be when the nerve is only irritated and inflamed. So this one would be the category of where you really have some nerve damage, where the nerves are actually damaged, and then this particular one would be inflamed and irritated. These 2 particular areas can result from different types of injuries, like cutting a certain area where it gets down to the nerve and causes the nerve damage or the inflammation, puncture wounds, burns, squeezed between dislocated bones, like some of the nerves can get squeezed between dislocated bones, or pressed against a whole bone by a tumor or some type of growth that's not supposed to be there. So you can have different things that are causing this nerve damage or this nerve irritation and inflammation. Diseases can also cause it, things like leprosy, diabetes we looked at. It can also be caused by overexposure to certain chemicals, mercury, lead, certain solvents, certain drugs. And so there's a lot of things that can affect the nervous system. And we studied the nervous system in AP biology, but then also when at the beginning of the year in health, when we were talking about the systems as a whole, and we were going through like maintaining health. And so we do have a lot of understanding on how important the nervous system is to our functioning. And so it has to be protected. And when we do have these problems, they can be treated by allowing the nerve to rest and repair itself, obviously. Now, we do remember there's a difference between the repairing of the peripheral nervous system versus the central nervous system. So we know that not everything can be repaired. This is why it's very important for us to take good care of our bodies as a whole. Surgery sometimes can help, medication sometimes can help, physical therapy. So these are just some general ones the book gave, saying, hey, if you do have some of these problems, nerve damage or nerve irritation or inflammation, there may be some helps for it. But when it comes to the nervous system disease and disorder, one of the biggest thing is brain injuries. And I'm going to do a whole page on brain injuries, but I just put a little introduction to it. So minor brain injuries or traumatic brain injuries are some of the big ones that you're used to, or you hear the word head injury or tissue damage or whatever. So with that, I broke down the brain injuries in their own tab because there was a lot of brain injuries that the book led us to study. So with brain injury, one thing we have to note is that they are the leading cause of death among young adults, the head injuries. And that's probably accidental, and some of these things, concussions, comas, meningitis, we'll talk about. That's a lot of times younger people will deal with that. So we have to be cautious. Well, I'm not in that category, young people anymore, like you guys are, but just taking really good care of our brain and making sure that our behaviors line up with safety, right? All right, so a couple of the ones we're real familiar with, concussion. So a concussion is a period of paralysis of the central nervous system, accompanied by a brief period of unconsciousness. So that's usually less than 5 minutes. So when you go and you look at the concussion protocol, like for sports and stuff, there's a certain thing, like do you experience this or do they experience that, to kind of give you the criteria for the concussion. So this isn't like a forever long thing about, usually less than 5 minutes. If it goes on too long, there might be signs of some real big problems, but you've heard of concussions before. Amnesia, that's a loss of memory. Sometimes this is very temporary, sometimes it's a little longer. And so you've heard of that one before. Coma. Coma, a prolonged state in which a person seems unconscious or unaware of his surroundings. And when somebody is in a coma, sometimes this could just be a few days or this could be years. And you've seen this before when it comes to the coma world, that people being in comas for long periods of time and they're still alive. And so what happens is it can result from more extensive brain damage, and it could cause damage being in the coma. And there's different forms of it. So forms, there's ones they call prolonged sleep, and that would be where they're just sleeping for long periods of time and you don't really sense any awareness. There's also, they're awake, but they show no outward signs of awareness. So they can open their eyes, but they don't show any signs that they know what's going on. Or then even some in the coma where they're conscious and aware of their surroundings, but unable to respond. So they can take it in, but they can't respond to you. And so there's different forms of the coma and how the brain copes with these particular injuries or whatever that caused the state of the coma. And then our book talks about meningitis. And so with meningitis, that's a big one to talk about, since a lot of the trouble with meningitis sometimes is in the area of the young people. And so meningitis is a condition in which one or more layers of the meninges, you remember that when we were studying the nervous system, becomes inflamed. And so with meningitis, we have to watch, and you've seen like the advertisements and stuff like that always talk about never sharing water bottles with like a lot of college students will do that, or high school students, and because of the meningitis possibility. And so you have to be careful with that. So when it comes to meningitis, what that really is going to be, and I didn't have a lot of room to put a lot of these details on there because I was moving on to the next page, but it's going to be a condition where when the layers and meninges become inflamed, the inflammation, the swelling inside the skull, so it becomes like painful, and you get the stiff neck and an intense headache, and then nausea, vomiting, and sometimes it says in more severe cases the pressure can impair the brain's function, causing the patient to become delirious and slip into a coma. So linking to that, and serious brain damage can result. Most of the meningitis is going to be the viral, most of the cases, but there can be bacterial meningitis from a bacteria getting in and causing the infection. It does say that all the people of any age can develop meningitis. Children are more susceptible than adults. And of course, they put you, teenagers, in that children's category. And so linking some of those specific symptoms to being very aware of what meningitis can do. And there's a certain amount of time for the onset where the person's brain damage can be limited if it's diagnosed quick enough and they get it under control. If it is bacterial, with the antibiotics and all that. So depending on what version you have. All right, and then there's encephalitis. You've heard of this. I think we talked about this. I think with encephalitis, with some of the infectious diseases, I can't remember. That could have been my microbiology class, but encephalitis is the inflammation of the brain. And so when the brain becomes inflamed, and it's most caused by viruses, sometimes it's bacteria and protozoa, and chemicals can do it too, where they can cause an infection in the brain, but most of them are going to be viral. Most severe forms are viral and transmitted by mosquitoes. So when we were talking about infectious disease, if you remember, we talked about the vectors, the living components which bring the disease, carry and bring it to you, and then also the reservoir world. But the mosquito would actually be the vector. And so with the mosquitoes, that the most severe forms of encephalitis. Most of the times this inflammation of the brain occurs from other severe infections, like the book says, like, so say you had chickenpox or measles or something like that. Sometimes the pathogen from that particular infection will slip through the blood-brain barrier and then therefore infecting the brain and causing inflammation. And of course, your brain, we talked about this before, your brain is inside that cavity and it's only so far that it can swell. And so it's going to start causing damage as it becomes inflamed. So we have to keep stuff that involves the brain as really high priority. All right, then another injury to the brain, shingles, painful infection caused by the, oh wait, why is shingles in this one? Injuries to the brain. I don't know why I put that one in there. And I guess it's underneath, well, maybe it's just in the categories of nervous systems disorders. Yeah, so this one really probably shouldn't be underneath there, but I'm not going to do another page just for this one. I don't know why I have that one in that same category. All right, so I guess maybe that was the end of the inflammation to the brain, and then I should have had a different category because then we have cerebral palsy. But that's also damage to the brain too, and epilepsy. That's neurons. So, well, anyway, so shingles, let's just go over it anyway. Shingles, painful nerve infection, because this is more nerve-based, and I don't know if I have it just in that, but caused by the same chickenpox virus. Usually a small pocket of virus survives the immune system. When you're a child and you get the chickenpox, a small pocket of the virus sometimes can survive after the immune system attacks and clears up the infection. It can hide inside the root of a cranial or spinal nerve. Oh, that's why it's in here. Cranial. Okay, I was gonna say. So the cranial nerve, and so when it hides and remains, and then later on, I mean, it could be decades later, stress or certain drugs, or, it says even in simple aging can cause the immune system to decline. And so therefore, once the immune system declines, it can reemerge because it's been hiding out in that root of one of the cranial or the spinal nerves. And so when it does, then you have shingles, and it's noted like pock-like skin rashes. So you still have the pox looking to the skin rash, but it's associated with the infected nerve. So it's very interesting that it's wherever that they were hiding out in that particular infected nerve, you'll get a flare-up of the rash. And sometimes they say it's like in a rectangular shape in that area where the nerve is connected to that part of the body. So it's usually on like one side of the body and one little rectangular patch. Pretty interesting. And it only occurs in those that have had the chickenpox. So what's interesting is you can't get shingles because shingles is like that secondary from the hiding. So you can't get the shingles from somebody who has shingles, but somebody who does have shingles can give you chickenpox. And then later on, you can get shingles if anything survives. And so you do have to keep that in mind, that there is a possibility of passing that on in a different way if you haven't had that chickenpox, they say. So, all right, so continuing on with the brain, I had to have multiple pages here, obviously, but don't forget, you don't have to take every little note. You just some main things. These are my notes, and so they're always more intense. All right, so cerebral palsy. Now, this is a disorder caused by damage to the cerebrum during birth or within a few months after birth. And so you've heard of people having cerebral palsy. So there's several different things underneath this category. So several different disabilities. Sometimes it's partial paralysis, weakness, lack of coordination, involuntary jerking movements. So depending on the severity of the damage to the cerebrum, you have different levels in that cerebral palsy. So it can be mild to severe and anywhere in between. Most common causes is when maybe at the time of birth there was a lack of oxygen sometimes, and this is why they're really quick to watch the baby, make sure the cord is not wrapped around the neck and all sorts of things. So we don't want to have a lack of oxygen once the child is in the womb or out, or head injury, or anything, even the diseases like meningitis or encephalitis that happening in childhood can cause eventually the cerebral palsy. So this is again something that can be a general category. And then epilepsy, also a kind of a general category of neurons in the brain periodically stop working properly and begin to fire together over and over, disrupting the normal brain activity and causing seizures. So people with epilepsy, they can be all, mild to severe, like any of the cerebral palsy, but two main categories: partial seizures. And so they can be categorized as partial seizures where they affect only part of the brain. So it might be mild or temporary twitching of or paralysis of just like a limb, or a limb going numb, something like that, more partial and not as severe. Or it can be generalized seizures, which will be generally affecting the entire cerebrum. And usually the person loses consciousness in this. So this would be more severe, the whole system kind of with the cerebrum. And you've heard people refer to these, the grand mal. Mal means sickness. So the big sickness, or petit mal, when somebody has a seizure and they're like, oh, it's a grand mal. That means it's like a really big problematic one, and versus a petite, a smaller one that isn't as severe. And so again, these are affecting the brain as a whole. And because we were talking about brain injuries, I wanted to do something, because our books are looking just kind of bunch of notes and nothing very exciting. So what I thought I would do for this is that I would send you some artwork that I looked up. I found a bunch of different artwork that was depicting the right brain, the left brain, like a bunch of watercolors and stuff that have the brain in the background, and then they have different things coming out of the right brain, different things coming out of the left brain, some really cool brain type of artwork as inspiration for you to create something to go here in the journal. And this could be watercolors, chalk pastels, anything, whatever, colored pencils, just to give us a little something, because I don't want these to have nothing in them until we can get back. And when we do get back, we're only going to have a limited time before summer hits, and we have all our summer groups and camps and stuff to do a couple of our activities, so we won't be able to do a whole bunch, sadly. So I want to have some kind of color or something in our books. So keep that in mind. I'm going to send some pictures on the Google Classroom with some inspiration for that. All right, so that's our nervous system and brain issues. And then the last two, looking at the diseases of the lungs or the respiratory tract as a whole, and then diseases of the urinary world in the urogenital organs. All right, so Pneumopathy. Well, there I am with my lovely pronunciation. But anyway, so any disease of the lungs. So when we look at the diseases of the lungs, like we've been looking at both, there's the non-infectious and the infectious world. Seems to be a big problem with the infectious side of the diseases of the lungs. Obviously, the non-infectious, the lung cancers, cystic fibrosis, asthma, all those are terrible troubles of the lung and the respiratory system as a whole, but taking a look at some of these more infectious parts our book led to. So the common cold, which is a viral respiratory disease caused by more than 100 different types of viruses. And that's good to note, because sometimes when you think of a cold, you're like, what is it? The rotavirus, what is it? And the fact that there are so many, and most of the time the common cold is mild. And sometimes when we talk about the respiratory system, and I put this in here, even though we know the respiratory system, just to note the upper respiratory tract and the lower respiratory tract. And just since we only had two more notes on this, once we got to this page, I thought it'd be better to put something in there that's a little bit more creative than just our notes here. And then that way, when I sent you, I'm going to send you videos on pneumonia and tuberculosis, you can use that. But before I get to that, the idea of the upper respiratory tract and the lower respiratory tract, different infections, and the common cold a lot of times being here in the upper respiratory tract between your nasal cavity, your pharynx, your larynx, whatever. And then you get your sinus infections up here in the paranasal sinuses. And that's what we're kind of used to. But to note that that's like over 100 different viruses that can cause some of those troubles of the common cold. So yet our bodies are made to be able to fight that. And that's also why it says in the book that it's not particularly important or necessary at this point to try to come up with vaccines or anything, because you've got so many of these guys, and it's usually pretty mild, the common cold. So you'd have to have so many to fight against that. What would be the point? Bronchitis, any inflammation of the linings of the trachea or the bronchial tubes. So this, once you get to bronchitis, you're moving down to the lower respiratory tract. So we've got the trachea here, the bronchial tubes, and you can, I'm saving this diagram for the videos to just to understand how pneumonia really works, and specifically with when we get to that with what's happening in our world right now. So I'm not going to color all this diagram, but just to note these particular areas getting inflamed here with the bronchitis. Okay, so bronchitis can be very mild, and it's usually when it's mild, it's usually triggered by the cold. So the cold that, the common cold situation, usually triggered by that. But the more serious kinds usually are bacterial infections. So when you get bacteria down in that lower respiratory tract, that can be very problematic. It can result also, bronchitis can result also from smoking or exposure to irritating chemicals. So anytime you cause your system to be in the presence of something it's not supposed to be taking in, like smoke or irritating chemicals, you can cause these very delicate tissues to become damaged. All right, then influenza, that one is we're really familiar with. Influenza A, influenza B, lots of different varieties of the influenza, and so it's very hard to track this one along with the common cold. It's a viral respiratory disease that causes weakness, fever, aching muscles, headaches, and chest pains. And obviously this many times is more severe than the common cold, even though we have some of the same types of coronavirus or corona-shaped viruses. I don't want to say coronavirus, but corona type that cause these. But the influenza can be way more severe, and it can be life-threatening. And again, even what we're seeing with the coronavirus right now, even just regular influenza can be life-threatening to elderly or ones that are immunocompromised. So that's nothing new to what the flu epidemics have been stating for years. It's just with the coronavirus of the day, the novel coronavirus, the SARS-CoV-2 is very it's way more transmittable than, the influenza A and the influenza B and some of the ones that we're more familiar with. So that's why it's given us a lot of trouble, but it's targeting the same group, the elderly and the immunocompromised. All right, and then with the lungs, pneumonia. So an infection that causes the alveoli of the lungs to fill with fluid. And we know those are those little sacs at the end where the actual exchange takes place with the gas coming in and then the waste products exiting. And so I'm going to send you a video with the pneumonia so we can understand specifically what's happening with those who are dying of the pneumonia that is linked to the coronavirus. So you can see sometimes pneumonia is in one particular little area, and it might affect, one little area of your lobe of your lungs. And that is very dangerous because anytime you get down in the lower respiratory tract, it's problematic, but it's dangerous. But what happens when it affects all of your lungs or the majority of your lungs? That's where the trouble really kicks in. So I'm going to send you a video to help understand that a little bit more, and you can use this diagram and color it in as you're going along and add your extra notes along the sides here. okay, that I send you to print out. And then another video I'm going to send you is tuberculosis, because it's interesting to understand tuberculosis, TB is what it says. This is a serious lung disease caused by this slow-growing bacteria, and the slow-growing bacteria is related to the leprosy spectrum. So if you hear back in the days of leprosy, it was not a good thing, right? So imagine that happening in your lungs. And so what happens is it's as the infection continues, the lung tissue forms like these little fibrous little lumps in the infected sites, which is going to cause you lots of problems. And it can be treated by the antibiotics, but it's hard to treat. As it says, that it's a slow-growing bacteria that is very difficult to kill. And so we work hard to combat the TB, and for a while we were pretty strong in that area, but like our book says, in like 1970s, I think they said, it started to make a comeback because many of the other nations, through like immigration and nations that didn't have it as under control, started to pop up again, and there was a resurgence. So this is a really dangerous guy too. So we're going to look at those two on videos and do some extras here to make it a little more creative, so you don't get bored to death with your little Miss Jody notes here, right? All right, and then our last one, uropathy, and we're finally done with this chapter. It went on for 7 years. 7 years on chapter 6. Oh, really? Anyways, good information, though. I've enjoyed a lot of this, just remembering all these different particular things that can go wrong and seeing how blessed we are when we have a healthy system. Like, wow, we need to not take that for granted, right? Uropathy, so a disease of the urinary and urogenital organs. Now, the reason that's important to add the urogenital organs, because the urinary tract system and all that, but many times when you have that particular system, it's intertwined with your genital organs. So you're using a lot of the same pathways. And so you can have problems with with the urinary tract that can also affect the genital organs, so the urogenital side of things, those who are sharing similar pathways. So with this, the worst, obviously, kidney failure. And this is a life-threatening condition, and due to the failure of the kidneys to function properly. You cannot live without your kidneys, and I'm sure when we studied this in AP Biology, we really hit this hard. Kidneys work around the clock to cleanse the blood of waste products. And so if you don't have that functioning correctly, waste buildup in the blood will cause death within 8 to 14 days. That's how amazing those kidneys and the nephron and all that that we studied. And the good old Lupa Henley, can't forget that guy. There is an artificial kidney machine called, that we refer to as dialysis, the process of using the artificial kidney machine. And it does what it can to clean your blood, but it's definitely not as productive as the real kidney that it was created to do that. Acute kidney failure. Now, this would be acute would mean onset, it wouldn't be chronic, so it would just come on from shock, heart failure, certain poisons, maybe in a bacterial infection causing the kidneys to shut down, wrong blood transfusion, things like that can cause the onset of acute kidney failure. And then there's also the chronic kidney failure, but that would be where it's more long-term, severe, prolonged infections, hypertension, atherosclerosis, which we talked about in the blood, but of the kidneys. Not the blood, I'm sorry, the arteries, but actually of the kidneys, or complications from diabetes. So these things causing chronic kidney failure, and that's a really bad place to be anytime you're messing with the kidneys. Kidneys, even in a small way, can be very problematic in areas like kidney stones. And what happens is the body gets rid of minerals that it doesn't use up. And so it normally would go into your urine, but there are times when unused minerals crystallize in the kidneys. And you can imagine crystallization. Just think of when you were younger, you're doing the little growing crystals and geology class or something, and you put the little sugar water or whatever, the borax, and then you let it crystallize. Just imagine some of those little chunky things being inside your kidneys and having to pass them eventually, these little pebble-like deposits, through your urinary tract and out So this is what's very painful. And kidney stones, some people get hospitalized, they can't pass them. Sometimes you have to have surgery. I've seen people go through so much pain, vomiting, nausea, and I'm always like, oh, I don't want kidney stones. I want to try to do my best to not have that. And sometimes people are more prone to it. It does say that more men than women are prone to it, and then it's usually ages 20 to 40 years old where it's a big that's the category where it sometimes is a big problem for people. And then with the urinary tract, the last part, the urinary tract infections as a whole, a category of an infection of any part of the urinary system. It could be the kidneys getting infected, which eventually might lead to kidney failure, but the bladder getting infected, your ureter getting infected, your urethra. I put these two, the book says, are the most common areas, the bladder or the urethra. And what they're saying is that what happens is the infection sometimes comes in through the urethra and moves up, and the bacteria grows in the bladder. And so you might, I have a bladder infection, and it's eventually linking to the UTI. And you can't mess around with UTI, urinary tract infections, because they can move up. The bacteria can grow and move into other places. So this little diagram, just so we have something to go along with this, just gave some illustration of when things go wrong in the system here. And so this, the collecting system, obviously, as it goes through all this nephron, then you got your little dripping down and collecting in your bladder. Hydronephorus, I think it is. Hydronephorus. That is when it's going to be inflamed like this. You see the difference between the two. And that can be from a kidney stone, an infection, an enlarged prostate, a blood clot, a tumor, something blocking the ability for the system to keep draining out the way that it needs to be. Hydroureter, that is a dilation of the uterus. So when this gets dilated because either blockage or whatever, like we said here, this can cause some major problems, and you will see that in your system, the malfunction. The urinary tract infection usually caused by Escherichia coli, we've talked about a lot, E. coli, entering the tract through the urethra and then having its growth there. Symptoms: frequent urge to urinate, pain, strong urine smell, etc. So it's just important, and they say, like with good hygiene practices, because we do know the Escherichia coli most of the time is good if it stays where it's supposed to, and where it's supposed to be is inside your intestine. And so when it does come out and you get it in areas where it might be able to find a new warm environment and whatnot to grow, that could be problematic. So good hygiene practices, and of course not allowing anything in that particular area that shouldn't be there. Okay, all right, so that is it. And then I saved a picture page in case we could do like a dissection or something. And then we'll have quiz number 6 for the next page. And then we'll move on to chapter 7. And chapter 7 is pretty quick. Well, I shouldn't say quick, but it's a little bit easier because it's just talking about drug abuse and some of the things that we can apply to our lives, understanding stimulants, narcotics, all that kind of stuff. So I don't think it'll be as intense as chapter 6, and we can go through it pretty quickly. And then we have chapter 8, and that's just a really mini chapter. Like chapter 8 is literally like, I don't know how many pages, but not a lot, like 10 pages long, if that, 8, something like that. And that's all on pursuing right relationships. So we're almost done with our book. And I'm hoping that we can still get together. Like I said, I really want to still get together and do something. And we still never got to do our health field trip and some stuff like that. So we'll figure out what we can do whenever we're going to be talking with the board. Actually, tomorrow night we have a Zoom meeting with our board to figure out when we can start our process of reopening and all that. So hopefully I'll have some good news and we can be back together again. Until then, stay healthy.